Time now to ask the expert. Here to answer your questions live on the air about hyperpigmentation is dermatologist Dr. Elika of Mayo Clinic. All right, our first one comes from Jamie in Phoenix. Do these turmeric and kojic acid foaming cleanser pads help? Because I see these ads a zillion times a day. Do they?
Okay, so turmeric is a great ingredient in the kitchen, and it's even great as a supplement. It's anti-inflammatory, it's an antioxidant, but it can stain the skin yellow. So I would be really cautious using this on my skin because you might have to take off a yellow stain with some harsh alcohol after.
Ooh, it sounds like it would make it worse. All right, Elika. Okay, this viewer says, I have melasma. I've tried everything from prescription drugs to over-the-counter products. Nothing has worked. How can melasma be successfully treated specifically for Black women?
So this is a great question. Melasma is very difficult to treat. It's a chronic condition. Pigmentation comes and goes despite using treatments. It's not something we can ever get to go away completely. But I'd have a few questions for this woman. Is she on any hormonally acting medications? Even an IUD can cause melasma. Is she using adequate sun protection? Has she had her thyroid checked? Sometimes thyroid disease can make melasma not respond to our treatments as well.
Yeah.
And then the last thing that's specific to Black women, hydroquinone is our favorite ingredient for melasma, but if it's used in high strengths for a long period of time, in darker skin types, it can actually cause another type of discoloration in the skin. It can cause a blue-gray discoloration in the skin called ochronosis. And every now and then we see this in darker skin patients that think they're still treating their melasma, putting hydroquinone over and over, higher strengths to try to get it to go away, but they actually have this more complex condition.
Wow. Okay, those are all really good questions to ask. And I would say, like, she probably should see her dermatologist.
She should get evaluated and make sure it's not ochronosis. If it's not, we do have devices and lasers that can actually be used safely in Black patients.
Okay, all right, good to know. AJ from Phoenix says, how can we get rid of dark spots, hyperpigmentation on the face from acne scars?
Again, really great question. Post-inflammatory hyperpigmentation from acne scars can linger for 6 to 12 months. The most important thing is to not pick at the pimples if you have active acne. I like to use something called a hydrocolloid dressing. It's like a little pimple patch. It's not medicated, but it helps heal the pimples and keep the hands off of them. So you put them on right before you go to sleep, and usually in 24 to 48 hours, that pimple has shrunk and it hasn't been picked to cause this extra inflammation.
Okay, doesn't it like pull the stuff out of it?
Yeah,
I think I've seen those little patches.
Yeah, they're fantastic. Now, if the hyperpigmentation is there, we do have devices and creams that can help to gently remove some of that pigmentation.
Interesting. All right. Cheryl asks, is the red light therapy mask good for hyperpigmentation? I've wondered this too, because we've done a red light therapy, interview before.
Right. You know, I'm not a huge fan of the red light masks. While they can maybe stimulate some collagen production, they're very expensive, and the quality of improvement you're going to see in your skin is very minimal. I would use ingredients, creams over the counter prior to using a red light mask for hyperpigmentation.
Okay, great to know. Well, you just saved a bunch of money. All right, Elika, thank you so much. I know we have more questions, so I'm going to cut you loose, and you're going to go to our green room. So thank you so very much.